When it comes to healthy aging, we often think of exercise, balanced nutrition, regular checkups, and social engagement. But there's one aspect of health and well-being that's often overlooked or considered taboo, especially among older adults: sexual, self-care, and more specifically, masturbation. Despite cultural discomfort or lingering myths, masturbation is a natural, safe, and often beneficial activity for people of all ages, including those over 60. In fact, engaging in this simple, private act can have a range of physical, emotional, and psychological benefits that support healthier aging and overall well-being. Redefining. Sexuality in later life aging doesn't mean the end of sexuality. While physical changes, medical conditions, or the loss of a partner may impact sexual relationships, the need for touch, intimacy, and pleasure does not simply fade. Self-pleasure offers a personal and empowering way to maintain a healthy sexual connection to oneself, especially in the absence of a partner. Masturbation can help older adults reclaim their bodies, maintain sexual identity, and enjoy a sense of closeness with themselves that nurtures confidence and emotional balance. Rather than being an indulgence, it becomes a legitimate and valuable part of a self-care routine. Hormonal and physical health benefits. One of the most well-documented benefits of masturbation is its effect on hormones and the nervous system. During orgasm, the body releases a flood of feel-good chemicals, including dopamine, oxytocin, and endorphins. These substances can reduce stress, improve mood, and promote better sleep, issues that many older adults struggle with. For women, masturbation helps stimulate blood flow to the vaginal walls, which can combat vaginal dryness and maintain elasticity, especially after menopause. It also supports pelvic floor muscle tone, which may help with incontinence and core strength. For men, regular erections and ejaculation, even through masturbation, support prostate health by clearing out fluids and reducing the risk of swelling or discomfort. It also helps maintain erectile function, as consistent sexual activity encourages healthy circulation and nerve sensitivity in the genital area. Boosting mental and emotional well-being. Self-pleasure isn't only a physical act, it's deeply connected to mental and emotional health. As we age, feelings of loneliness, isolation, and loss can increase, especially after the death of a partner or friends. Masturbation provides a private, comforting form of intimacy that reminds people they are still capable of experiencing pleasure and connection. It can also improve body image and self-esteem. In later years, people often struggle with accepting the changes in their bodies. Engaging in self-pleasure with kindness and curiosity allows for a renewed appreciation of one's physical self. It shifts the focus from what the body used to what it can still enjoy. Better sleep and stress reduction. Many older adults report difficulty sleeping or managing chronic stress. Masturbation can naturally ease both. The relaxation that follows orgasm often leads to a deeper and more restful sleep. The release of endorphins acts as a natural painkiller and mood enhancer, reducing anxiety and promoting a sense of calm. This can be especially helpful for people dealing with chronic pain, such as arthritis or back issues. While it isn't a cure, it provides a safe, drug-free way to improve the experience of pain and discomfort in the short term. Supporting autonomy and independence, masturbation empowers older adults to continue having control over their sexual health. It doesn't require a partner, specific timing, or external circumstances. It can be adapted to fit individual comfort levels, health conditions, or physical limitations. This makes it a deeply personal and customizable act of self-care. In assisted living environments or among those with physical disabilities, masturbation may be one of the few ways to retain sexual expression. Open conversations and respectful support from caregivers and family members can help normalize this aspect of life, fostering dignity and mental health. Breaking the stigma. Despite the clear benefits, masturbation among older adults is still rarely talked about. Cultural taboos, religious beliefs, and generational silence often make it feel shameful or inappropriate. But education and openness are powerful tools for change. Doctors, therapists, and caregivers should be encouraged to bring up sexual health as part of routine care. When masturbation is discussed without shame, it creates space for people to explore their needs without guilt or fear. Conclusion: masturbation is a normal, natural, and healthy part of life at any age. For people over 60, it offers a host of physical, emotional, and psychological benefits that support aging with vitality, confidence, and connection. Whether it's for stress relief, hormonal balance, emotional comfort, or simple pleasure, self-pleasure deserves recognition as a powerful ally in the journey of healthy aging. It's time to drop the stigma, embrace the science, and celebrate the fact that pleasure doesn't have an expiration date. Incorporating self-pleasure into a wellness routine, just like any other wellness habit, be it walking, journaling, or meditating, self-pleasure can be integrated into your routine in a way that feels natural and supportive. There's no need for elaborate planning or a specific goal. The key is to listen to your body, honor your comfort level, and remain open to what feels good. Creating a comfortable private space is a helpful starting point. Whether it's a cozy bedroom, a warm bath, or a quiet moment with the door closed, having a safe and relaxing environment can enhance the experience. Some people enjoy using lubrication, toys, or sensual music. Others may find simple touch and imagination to be more than enough. It's also important to let go of any pressure to perform or achieve orgasm every time. The act of exploring, feeling, and connecting with yourself is therapeutic in itself. The goal is pleasure and self-connection, not perfection or performance. Communication and openness in relationships. For those in relationships, conversations about masturbation can actually strengthen intimacy rather than threaten it. Many couples over 60 find that talking about self-pleasure creates more openness and comfort around shared sexual experiences. Partners may explore mutual masturbation, incorporate it into foreplay, or simply support each other's individual needs. This can be especially important in cases where one partner has medical issues or a lower libido. Rather than seeing self-pleasure as a substitute or threat, couples can embrace it as a complementary part of their intimate life. Open communication also helps dispel misunderstandings and reduces shame. For many, hearing a partner say they still feel desire or enjoy their body is a beautiful affirmation of love and connection. Adapting to health changes, aging comes with its share of physical changes: joint stiffness, limited mobility, chronic illnesses that can affect all aspects of life, including sexuality. The good news is that masturbation is incredibly adaptable. Positioning pillows for comfort, experimenting with different motions, or using assistive devices can make the experience more accessible. People who take medications that affect libido or blood flow should speak with their doctor to understand their options. In some cases, small adjustments in medication or routine can restore balance and make pleasure more attainable. For those who have undergone surgery or experienced grief, masturbation can be a gentle and healing way to reconnect with their body. It becomes a reminder that pleasure is still possible and that one's body is still worthy of love and care. Resources and support today. More resources exist than ever before to support healthy sexuality in later life. Books, websites, workshops, and even healthcare providers are beginning to address the needs of older adults with more compassion and clarity. Sex therapists and counselors trained in aging-related issues can offer guidance for anyone struggling with shame, confusion, or physical limitations. Educational materials can also help dismantle outdated beliefs and offer science-backed reassurance that masturbation is a valid, beneficial practice at any stage of life. Even adult stores now offer discreet, body-safe products designed specifically for older adults, including ergonomic vibrators, lubricants for sensitive skin, and tools that promote comfort and confidence. A celebration of lifelong pleasure. At its core, masturbation after 60 is not just about sex. It's about joy, connection, healing, and embracing a full life. It reflects a shift in how we define health. Not just the absence of illness, but the presence of vitality, purpose, and personal fulfillment. We often speak of aging with grace, but we must also allow ourselves to age with pleasure. Sexual self-care is one of the many ways to nurture that pleasure. It's private if you want it to be, shared if you choose, and always worthy of respect and dignity. There is no shame in wanting to feel good. No expiration date on desire. No limit to the ways we can explore our bodies and celebrate the life within them. So whether you're returning to self-pleasure after a long break or simply curious about its role in your wellness journey, know this: it's never too late to rediscover yourself, and it may be one of the healthiest things you can do.